So I kind of want to answer to what you said. I will not to not lose more time, but so I will talk about feminist health activism in Flux, the case of menstrual health, and try to illustrate some of the points actually that were made. So that's a brief outline, but why feminist activism matters. Because without feminist activism, we will not even be talking about women's health. Well, just not like that, not like an inequality that has to be fixed. As it was said, feminist health activism is not limited to the abortion fight and reproductive rights, but it was also a broad critique of medicalisation of female bodies and gender. And so it's an issue of what briefly shortened as power, knowledge, and expertise. And so feminist movement has actually developed women's health centers and initiatives in order to reappropriate medical knowledge and health practices. They developed self-help, research, and they contested bad sciences. So I will try to illustrate this history and the current situation with the menstrual health issues. So that's the general summary of the second wave feminist critique of medicine. So professionals, medical professionals, but health professionals in general are seen to play a big role actually in women's oppression, both in their health practices. We mentioned reproductive rights, but other kind of issues, but also as a public expertise that was dictating what women could do and should do. The second main critique is that medicine is actually based on bad science, male-centered, poorly conducted, and like it was repeatedly showed, feminist studies after feminist studies, how medical research was poorly designed, one-sided, and so on. And there was always, well, very regularly, sexist assumptions, pathologizing physiological processes of the female body. I mentioned a few here: menstruation, menopause, pregnancy, and so on. So my example of menstrual health started with the premenstrual syndrome, or PMS. And that's a short chronology of when the issue appeared in medicine. It started already in the 30s with the idea of premenstrual tension. It was framed as premenstrual syndrome by Catherine Dalton and Raymond Green. And it was popularized in the 80s, first in the UK, through a few public trials that would use the PMS as a defense for female violent offenders. And then it became a feminist issue when the American Psychiatric Association tried to introduce a psychiatric version of it, now called a premenstrual dysphoric disorder. It has several names. And it was finally introduced in the last version in 2013 of the DSM, the 5th edition. So the historical critique of the PMS, I summarize it as three kind of critiques. So the first is what I call the culture in the body, PMS as a social construct. And so that feminist researchers and activists have shown how, first, there's a context in which the category emerged, especially when women started to be a force on the job market, when they entered the workforce. We had the first big pick in studies about how menstruation make women dangerous, and they cannot be pilots or drivers or so on. Then there's the second peak in the 80s is also correlated with drug manufacturing. So drug companies are trying to label some new drugs to treat PMS. That's the rebranding of the fluoxetine, especially as a Sarafem. So that's another issue. And also there's many studies that show how PMS is culture bound. So you don't find the syndrome everywhere. It's not the only case of gender issue. Menopause also doesn't happen everywhere the same in every culture. It even doesn't happen actually in some places. And so the second critique of bad science, so PMS as a scientific misconstruction. I will not have the time to go into detail, but again, poor studies design. For example, it was assumed that women had a fluctuation in mood and behavior during their cycle, but there was very rarely a study showing mood fluctuation of men. So it's hard, there's no, yeah, so that's one of the one-sided issue, but there's many of them, other kind of bias, also in the way like data is collected. Actually, in a lot of menstrual cycle studies, they don't know the menstrual cycle phase they're actually trying to assess. It's usually reported, and this is the last period, which is supposedly telling you where the woman is in her cycle, but we know it's absolutely not reliable. So there's a few of those major design flaws. And the last critique was to show how PMS is participating to medicalizing gender norms, especially around the cliche about the angry woman, the irrational woman, whether it's during her cycle or not. And also the idea of the female body as more fragile and vulnerable. That's some covers of this feminist research. I put in big the thing red because I think the cover is amusing. So as a scholar from different disciplines, but grossly feminist science studies, I started to be very surprised to hear contemporary women collective, feminist collectives actually talking again about PMS, about premenstrual dysphoric syndrome as a thing that should be recognized and we should do more research about it. And I was like, what? I've learned my feminist studies that I just showed you, and I was like, this was very much criticized by feminists and women before. So what is happening today? So I started this little, it's not a lot, exploratory qualitative study in Montreal, in Quebec. And I just also want to mention the little caveat I put here. We did not recruit women on the criteria that they were feminists, but actually most of them were self-identifying as feminists, and a lot were feminist activists. Some on this issue, some not. But so these women were actually reframing the medicalisation critique, asking for better doctor-patient relationship, mostly. What was always coming in the interviews, what they needed to be, to feel validated, both in their experience, but also in their knowledge. Like it's usually women who had trouble to get a diagnosis about their menstrual issues. And so they are very informed when they show up for the doctor appointments, but still the doctors are resistant to recognize that they might have some knowledge about the topic. And so this idea of feeling validated and listen is really the predominant problem. And second, there's this belief that we don't know anything about menstrual health, that there was no studies made, which is partially the case, but still there's some data on it. So compared to the historical critique, we have no link in our interviews made between the pathologization and medicalisation. So it's treated as two separate issues. So it's not like when I have a menstrual issue, it's normal, it's in the range of the normalcy. It's not like a pathological condition, but it still should be met with a medical answer and a medical help. And so when medicalisation is mentioned, and if it's criticized, it's usually around the issue of drug treatment. So this is not the only way to treat menstrual health issues. There's a huge issues around treating it with hormonal treatment or with antidepressant for people with mood disorders. And so the claims are actually quite medicine-centered. They want better diagnosis, they want more medical research and more treatment. And if they consult actually alternative care, acupuncturists, naturopaths, and so on, and psychologists, they didn't develop a collective approach like self-help in Women's Health Center, for example, that was present in Montreal in the 80s, for example. So they actually support the pedagogical role of doctors, which some doctors are complaining about, because another part of the research is actually to talk with health professionals. I don't present that part, but like doctors think they're asked to do too much. They complain more about lack of science than about bad science. I already mentioned the individual claim versus the collective actions of before. And interestingly, as we just talk about gender and maybe gender embodiment, the fact that the issue might be biological is not seen as related to sex. It's probably, for them, an effect of the toxic environment. So most of those women think about hormonal imbalance as and not rightly, as an effect of like toxicity in the environment and the idea that hormones are now everywhere. And that's the other point I wanted to make before, is that a lot of this talk about menstruation and premenstrual issues popped also probably because of a drop in taking the pill. A young woman had a very much like a scare about the pill side effects a few years ago. And so there's clearly a drop in the use of the pill as a birth control, and probably the fact that women are taking less the pill is increasing this phenomenon of menstrual issue and bringing it to the central stage now. So a few points for the discussion. So to be clear, there's always an ambivalence. There was always an ambivalence of the feminist critique of medicalisation. I put here a quote by Barbara Ehrenreich and Deirdre English. It seems that from one moment to the next, we either accuse the medical system of treating us as if we were sick or of not realizing how sick we are. And that's like, I think, a big issue in women's health when we talk about it. So like from a feminist perspective, is that at the same time, too much medicalisation, but also not good medical care. So this ambivalence is very present. So the second point is in the study we've done, the medicalisation critique is not as explicitly about power, but the good care that they mention, what I call interpersonal equality claim, hides actually issues of power. The need to be listened to and believed and to be recognized as a source of knowledge, self-knowledge, is of course an issue of power. And self-help might be replaced by individual practices of self-care and alternative medicine, but the ideal therapeutic relationship is still a knowledgeable but paternalistic doctor. So I wanted just to bring a few points for the discussion, the more general discussion of the feminist critique of medicalisation and its ambivalent result for women's health. It attracted attention to understudy women's health issue, but of course, it contributed then to reinforce their medicalisation. And that's a critique that has been done for pregnancy and childbirth also. Women, they are still considering themselves insufficiently informed about their body and health, but they also still consider medicine as the best source of information and the expertise that they should seek for. And even though power issues persist, they are not framed in terms of politics of power relations, but rather about as a behavioral issue. So they need to listen, they need to learn to communicate better, and they need to have better knowledge and be more pedagogical. And when there's a serious act, it's framed as violence, which it is. I'm not saying there's no gynecological and obstetrical violence, but it's not read as a differential of power issue necessarily. That's it.